Assalamualaikum warahmatullahi wabarakatuh. What's up, guys? Good morning, good afternoon, good evening to all of you. Previously, let me introduce myself. My name is Bahrul Hayat. I am first year medical student, University of Bengkulu. Okay, on this occasion, I will present an article with the title A Comparison of the Effectiveness of Azelaic and Pyruvic Acid Pills in the Treatment of Female Adult Acne, a randomized control trial. Written by Karolina Chilicka, Aleksandra Rogowska, Renata Szyguła, Iwona, Dzieńdziora, Urbińska, and JakubTaradaj. Okay, background. Characteristic of acne vulgaris. Acne vulgaris is a chronic inflammatory disease of the skin that is characterized by comedones, seborrhea, nodules, papules, pustules, and scarring. The sebaceous glands are formed as a result of elevated testosterone levels, follicular hyperkeratinization, and excessive colonization of Cutibacterium acnes, which leads to immune reaction and as consequence to inflammation. The prevalence of acne vulgaris is widespread, with 95% of boys and 83% of girls at 16 years old experience it. Females suffer from acne vulgaris at an earlier age in comparison to males. Most likely, this is a result of the earlier onset of puberty among females. Okay, treatment of acne. Topical treatment is used most frequently for acne patients. In particular, topical maintenance treatment is recommended after treatment discontinuation in adult female acne to decrease the risk of acne relapse. Concurrently, systemic drug therapy may also be included depending on the severity of the disease, because the pathogenesis of acne is multifactor. Treatment should comprise various methods. And then clinical effect of azelaic and pyruvic acid pills on acne. Peeling is one of the oldest and most popular cosmetic procedures worldwide. Superficial chemical peels, also called refreshing peels or light peels, are defined by the application of one or more agents to the skin with the aim of mild desquamation. Pyruvic acid is an alpha keto acid which has gained significant attention in recent years because its various keratolytic, antimicrobial, and sebastatic properties, as well as ability to stimulate the formation of new collagen and elastic fibers. Azelaic acid is naturally occurring saturated C9 decarboxylic acid, which is effective in the treatment of acne. It has shown anti-inflammatory and antibacterial properties against acne bacteria. Okay, next is aim. The study aims to explore the difference in the effectiveness of azelaic and pyruvic acid pills in the treatment of acne vulgaris. Okay, but now I will call azelaic acid with AA, remember that, and pyruvic acid with PA. Okay, I'll talk about AA and PA acid are well known in acne treatment. There is an insufficient knowledge regarding whether the efficacy of this acid is similar or significantly different. The study compares AA and PA to examine their effectiveness in the treatment of acne vulgaris in the young adult moment. To the best of our knowledge, we are exploring the efficacy of the two acne treatments for the first time. Thus, we didn't formulate any specific hypothesis. Okay, methods. The study was designed as prospective randomized clinical trial. The sample size was determined using the Cochran formula with correction for the small population. Eligibility criteria of participants were female gender 18 years old till 25 years old, no dermatological treatment within the last 12 months, and mild to moderate pustular acne. We treated 120 young women with mean age of 22 years old with 6 peeling sessions at 2 weeks intervals in the parallel clinical study design. One randomized group, some 50%, was treated using azelaic acid or AA, whereas the second group participated in pyruvic acid or PA sessions. We evaluated the patient clinically twice, before and after treatment. We're using the scale of Helen-Vincent severity symptoms to assess the acne diagnosis and the NATI analyzer to estimate the skin properties, oily skin desquamation, porosity, and moisture. Okay, the results of the research is the number of participants who were randomly assigned and received the acid pills was 60 in both AA and BA groups. There were no cases of loss and accretion after randomization. The mean result standard error and 95% confidence interval are shown in the table 1. See table 1, this table 1. And the table 2 shows the result of one-way ANOVA weight to the assumption, the degree of acne severity symptoms, and the SHVSS decreased significantly under treatment of both acid AA and PA. And you can see in figure 2 the effect size estimated by NV2 for the main effect of treatment test was very large and was very able to explain about 80% of acne variants. There were no significant difference between AA and PA acid fields in the treatment of acne. The percentage of oiling and desquamation of the skin significantly decreased as a result of treatment with acids. You can see in the figure 2. The effect size estimated by NV2 for the main effect of the treatment test or retest was large for oily skin and could explain about 31% of variants, and medium for peeling skin with 9% of total variants explained. The group treated with PA saw significantly less oily skin compared the group treated with AA, but the effect size was small with 3% of the total variants explained. Other indicators regarding pore size and skin moisture did not change significantly. There was no interaction between the groups and acid therapy. Okay, next is discussion. The efficacy of azelaic and pyruvic acid pills in reducing acne symptoms. The study found that AA and PA produced similar decreases in the acne severity and lesions. The main difference of SHVSS between the baseline and week 12 of acid treatment indicate that using either AA or PA may reduce acne symptoms. To mean overall global improvement was 40% in both treatment groups. A comparison of change in skin parameter under influence of AA and PA peelings. Both AA and PA produce significantly lower desquamation level by about 1% at week 12. The other skin parameter, including pore size as well as moisture, U and T level, did not change significantly under the influence of AA and PA. However, significant difference between these two agents were shown in the extent of the oily skin level. PA tended to reduce oiliness to greater extent by about 19% at week 12 than AA, by about 13% at week 12. The effect of AA skin graysoness. In contrast, the results of the research are inconsistent and seem to depend on the method of treatment and combination of acid with the other cosmetic agents. Okay, the next is conclusion and suggestions. The conclusion is the effectiveness of azelaic and pyruvic acid in acne treatment is comparable as confirmed in the study, but acid produced similar decrease in acne severity and lesion and decreased desquamation. However, PA reduced greasy skin to greater extent than AA. The selection of patients is minority when choosing between AA and PA pills. An acid treatment should be related to the skin structure, the expected effect on the oiliness of the skin, and the extent to which side effects occur. The sense of safety in women during hormonal therapy, pregnancy, and lactation should be prioritized. Okay, the last is suggestions of the research. The results of this study are promising but require confirmation in further research. The first limitation of the study may be measurement in the future. We would like to use more precious measuring tools. For example, Dharma Unit SSC3, Kosaka Electronic. A specialist camera will be used to improve the test quality of the study. The PCR RPP 34 camera used a specific UV light to visualize the fluorescing acne lesion of an area of at minimum a nanometer, 86.4 millimeter. The orange red orange indicate the presence of P. acnes bacteria within clinically non-evident. Clinically evident reason to other limitation of the study is the research sample in the term of two genders and age. The study focused on a homogeneous group of young women, and so results cannot be generalized to men, adolescents, and older people. In the future, a large sample size so participate in the study, including both women and men with acne, as well as people without any skin problems or disease for comparison. Furthermore, we would like to examine adolescents as well as adults above 30 years old with acne. Okay, maybe that's all enough. Thanks for attention. If I have many mistakes, please forgive me. And don't forget to like, comment, and subscribe on this channel, on this video. Okay? Thank you. Wassalamualaikum warahmatullahi wabarakatuh.